So let's talk about the discharge summary, because the discharge summary is important for a couple reasons, and there's a very prescriptive way to do it. There's certain elements you need to put in. I see discharge summaries all the time that don't have the elements. The elements are actually prescribed by the hospitalist associations all across the country. It's a national organizations say what should be in it, and certain elements need to be in it, and there's a good reason to have those elements in it. So if you don't know what that is, I'll talk about it a little bit, but you can look it up and you can find out what those elements are. The purpose of the discharge summary is to summarize all the care the patients got in the hospital during that episode of care. Now, why is that important? Well, it's important because the patient's going somewhere after the hospitalization. They're going to go home. They're going to go home with home health. They're going to go to a skilled nursing facility. They're going to go to custodial care. They might even go to an LTAC, which is a high-level skilled facility that takes care of ventilator patients, trach patients, chronic wound care. So just like your documentation in the medical record is a fundamental step you need to do to communicate, the discharge summary is the fundamental tool to communicate to the post-discharge care team what went on during the hospitalization. They're going to read that discharge summary. If they read your discharge summary and it's not very good, they're going to do one of two things. They're not going to know the patient well. The patient's not going to get really good care. That's going to be partially your responsibility. Now, if they're a conscientious provider, they're going to go and look at the actual record, and they're going to have to try to recreate the visit, which is going to take them 10 times more than it would have taken you just to do it. So do it for the patient and do it for the next doctor that's going to be getting that patient. So let's go through some of the elements. You want to put in the date of admission, the date of discharge, what medications they're going home on. You want to review the tests, the x-rays that have been done, and any abnormalities. You want to say what further testing needs to be done for follow-up. You want to say who needs to follow up with that patient and when they need to follow up with them. For example, patient came in with abdominal pain, patient's doing better now, but they need to see the gastroenterologist in 3 weeks in order to get an endoscopy. And finally, the most important part of your discharge summary is the hospital course. And you have to do it in a problem-oriented fashion. Patient comes in for chest pain. Problem number one, chest pain. Patient came in, they ruled out for MI, but the cardiologist thought it was unstable angina, catheterization was done, and a stent was placed. They might have heart failure. They might have COPD. Each one of those significant problems needs to be addressed in your discharge summary so the doctor who's taking care of the patient once they leave knows exactly what went on with those problems during the hospitalization so they can continue that care in a fully informed manner and in a coordinated manner, because we know that fully informed care, coordinated care, and care that's facilitated by communication is better care with better outcomes.